Let's talk about nasal breathing under the oral motor section of your assessment form. If you don't yet have an assessment form, click the link below, enter your email address, and a full myofunctional therapy assessment form will be emailed to you so that you can follow along as you click through these videos. So far we've looked at lip seal, we've looked at tongue to palate, and we've looked at teeth slightly apart. You'll notice if you have your lip seal and you have your tongue up and your teeth slightly apart, there's no way you can be breathing through your mouth. So we already know you're a nasal breather, and that's great. If you are, write WNL and move on to the next part of the assessment. If you notice that your lips were open in a previous part of this assessment, and you've also noticed that you are typically breathing through your mouth, then that's something we want to discuss. We want to figure out if this is more of a habitual issue or more of a structural issue. So first things first, go ahead and close your mouth, or ask your child, if they're old enough, to close their mouth. Start the timer, and let's see if you can breathe through your nose for the next 2 minutes. If you can, and that's no problem, then we know this is more of a habitual issue. And that's typically a better thing because it's a little bit easier to fix. If you notice that you can even make it to 2 minutes, or when you got it to 2 minutes, you were short of breath and you're almost gasping for air, then we know there's something else going on. For whatever reason, you are unable to get enough airflow through your nose that's sufficient for your oxygen needs. This could be a structural issue in terms of facial growth. This could be a congestion issue. It just gives us information that you potentially have something else going on that we need to address, potentially with another provider or with very specific exercises in order to clear some of the congestion that may be going on with your nasal cavity. Okay, another thing to note is you could have been sitting posturally with your mouth open, but still breathing through your nose. Now, some people will say, well, at least I'm breathing through my nose. But the thing is, in terms of forces acting upon your bones, it still has the same effect as oral breathing. So we do want to make a note of that if you typically have an open mouth resting posture, but you're still a nasal breather, because that is something that we would want to address as we go through this process. If you have any questions with this one, please write a question below in the comments section or find me at summerspt.com. I would be happy to help.